Hi, I'm Dr. Fischelberg. Today we're going to talk a little bit about febrile seizures. Febrile seizures are fairly common and they're very frightening to parents, understandably so, but it's important to know that they're very benign, they're innocent. They do not lead to brain damage, they're not dangerous for your child. So the first point I want to make very clear is a febrile seizure is probably the most terrifying few minutes of your life as a parent, but it's completely innocent and completely benign, and don't panic. A simple febrile seizure typically occurs in a child between 6 months of age and 5 years of age in the context of a febrile illness, a flu, an ear infection, strep, some sort of illness that causes a fever. The height of the fever does not necessarily indicate whether or not a child's going to have a febrile seizure, but the rate of rise, the rapidity by which the temperature rises is what triggers a febrile seizure. And you really have no control over that. You have no idea that your child who seems okay 1 minute, who turns around and has a 102 fever an hour later, is going to have a febrile seizure. So there's really not much you can do about it. But know that the absolute number, the 103, the 104, the 105, doesn't mean your child is likely to have a febrile seizure. It's really how quickly the temperature rises. A simple febrile seizure is characterized by lasting less than 15 minutes. And I know what you're thinking, 15 minutes sounds like an eternity, but if a seizure lasts under 15 minutes and there's no focality, there's symmetry to it, there is symmetry. So a focal seizure would be just one side of the body, that would be more worrisome. So no focality, and there's no recurrence. You have one seizure in a 24-hour period, no recurrence, that's a simple febrile seizure. It's in the context of a febrile illness, it lasts less than 15 minutes, there's no focality, and it does not recur. That's the definition of a simple febrile seizure. It's probably worth calling 911 or your doctor's office the first time your child has a febrile seizure, but the most important part of that workup is really going to be looking for the cause of the fever. The seizure itself is really not worrisome in that context. Now, a complex febrile seizure lasts longer than 15 minutes. There's focality to it. It recurs, meaning it's the second one in under 24 hours. Those kids typically need a trip to the emergency room and a consultation with a neurologist. Now, a lot of parents will ask, if my child has a febrile seizure, what does that mean going forward? Well, there's two things to consider. Number one, your child does have an increased risk to have another febrile seizure in the future. About 1/3 of kids that have a febrile seizure in the past will go on to have more febrile seizures. Now remember, 2/3 don't. So 2/3 is a reassuring number. 1/3 is a pretty big number. So just know that if you have a febrile seizure, there's a good chance you'll have another one. Remember, they're innocent. Number two, parents want to know, does this mean my child's more likely to have epilepsy or non-febrile seizures in the future? And the answer is really no. About 1% of kids will go on to have epilepsy in just the general population. And if you've had a febrile seizure without any other risk factors for epilepsy, your risk is about 2%. So it really doesn't impose a greater risk for epilepsy going forward, provided that your child has no history of complex febrile seizures, no family history of epilepsy, and no neurological or developmental issues otherwise. So for your run-of-the-mill healthy 2-year-old kid that has a super bad virus with an ear infection and it triggers a febrile seizure that lasts 5 minutes and takes a couple of years off your life and adds a few gray hairs to your head, your child's going to be totally fine. The febrile seizure itself is not dangerous, does not really mean there's much risk going forward for epilepsy. And going forward, you just know that it's something that your child had and that we're aware of when they get sick. Our nurses are available on the phone to answer questions if you're ever worried. We're always happy to see these children and talk to parents about it because we know a febrile seizure is among the scariest moments in your life. Just know that it's really relatively benign and your kid's going to be totally fine. Thanks so much.